It's a pleasure to be serving on this panel to introduce Barrigel. I am a radiation oncologist and was privileged to have these patients to put on this trial, and I thank them for it also. In being the principal author on both trials, I had the privilege of looking at all the data, and I always wanted a better version of spacing. And I think that Barrigel has definitely given me all the things on my wish list. So let's start with first comparing the two trials. The SPACER trial was in 2016, which was published in the Red Journal. The Barrigel was published in JAMA Oncology just last week. And it is a more current trial in the sense that it is a hypofractionated schema that it is utilized in the US compared to the conventional historic fractionation of 79.2 gray. There was a similar number of patients in both cohorts, 201 and 222, making a good comparison, but there was a higher grade and larger prostates treated on the Barrigel trial, and patients had a higher risk of disease where ADT was allowed to be utilized on the Barrigel versus excluded on the SPACER trial. In regards to the effectiveness endpoint, like Martin had just stated, there was greater than 25% reduction in the rectal V54, whereas the SPACER was reduction in the V70, and the patients who met the primary endpoint were similar in both 98.5 with Barrigel and SPACER was 97. Getting to safety, the results showed that there was a superiority to control in reduction of the grade 2 GI toxicity in Barrigel versus the marker that was used was only grade 1 GI toxicity in the SPACER trial, and we'll get to that again. There was acute GI toxicity superiority seen in Barrigel, grade 2, but there was none seen with SPACER, and the long-term GI toxicity was similar in both arms. Now, when you utilize Barrigel, you can see it better, you can place it better, and this is where I think the biggest difference came in, was in Barrigel, it was only a less than a 1% chance of having rectal wall infiltration versus 6% in the SPACER trial. In real numbers, it's 1 patient Barrigel versus 9 in the SPACER. When placing the gel versus the two, I had, again, privy to see all the imaging for the patients in both arms, in both studies, the SPACER and Barrigel. And there was a greater than 95% symmetry that was seen in the Barrigel study at midline, and only half the patients had that type of symmetry in SPACER. If you go to the next slide, it'll show you a good representation of what I saw in those studies. There was 95% of the patients had great implant symmetry. Over here, it's shown at midline and it's shown, in the mid prostate, but this was seen down from the apex to the base, from the left side of the prostate to the right side, whereas this is a 50% of the patient showed this picture on the SPACER trial, where it was completely asymmetrical, and obviously there's virtually no spacing at the left side of the prostate on that image. Barrigel is the first and only hyaluronic acid spacer designed specifically for tissue lifting, basically using cosmetic procedures initially, but this hyaluronic acid is naturally present in the human body. Its internal structure and engineering allows for displacement and lifting power, making it ideal and sculptable material for rectal spacing, as seen on this nice video pictogram. And this gives you, precise control over the implant because it is a non-polymerizing substance. You don't have 2 syringes where you have to, manipulate 2 syringes onto 1 needle. There are no time constraints. You can stop and confirm the needle placement throughout the entire procedure. And it does if you want, take longer to put than SpaceOAR, but it gives you that ability to spend that extra time if you really want to get a good implant. It's all about quality. It's not just about volume. It's a quality that you can get from top to bottom, left side to right side. And what we noted in, what I noted personally in these two trials is that sometimes these patients did feel like they were sitting on a hockey puck. But in the Barrigel trial, we did not see any of these patients complain about that. And maybe this is because of the viscoelastic nature of the product. So it's also sculptable. It allows for that sculpting because you have time, you can sculpt it, and it can maintain that space. All these patients are different. The placement of this can be different from apex to base. The hypoechoic nature is truly remarkable with this product, with Barrigel, because you can see what you're doing. You get a self-assessment of where you're placing the product, so you can adjust it while the patient is on the table, rather than in most pathways, the product is put in, then it's taken to the CT. And only at that time with SpaceOAR were we able to see that we had an asymmetrical distribution. But with Barrigel, you're able to see that right when you have that needle in the placement and make any changes at that time. Here's a nice summary slide, and it is the only rectal spacer with high ultrasound visibility. You're able to assess the product while you place it. There's no hydrodissection required. And because you can see it, and because you have that control, and because you're having quality placement, there were 0 detected related adverse events. And one of the hidden qualities of Barrigel is that it's reversible, even though it is rarely utilized. If you need to reverse it, you can have this product called hyaluronidase that can reverse the Barrigel. This is studied in a currently used fractionation scheme, hypofractionation, and it is shown to be superior in reducing grade 2 GI toxicity compared to control. And over here, there's a nice picture of, on the left pane, you see the needle and then you see the Barrigel in the middle pane. And why I bring this, I think this is relevant, is that hydrodissection doesn't make anything safer, as we see in this slide, because you don't really need it, because you can see exactly where the Barrigel is being placed, because the needle is in the middle of the hypoechoic space. You know exactly where it is. You have greater control, you have greater visibility, and in that regard, you have greater safety and better outcomes. So this trial proved that you did not require hydrodissection, because you can see with the rectal wall invasion numbers that there was only one patient who had a rectal wall invasion versus 9 patients with the SpaceOAR trial. And operators were allowed to utilize that hydrodissection, but that was dropped very quickly as soon as they were amazed at how well you can see the Barrigel. And if you can go to the next slide, you can see that it's highly visible, and but it's also very safe. The non-animal stabilized hyaluronic acid has been utilized for greater than 25 years. Mainly, it's been used with cosmetic procedures in men and women, greater than 50 million procedures. But it's also the #1 used agent for pediatric urology bulking in vesicular urethral reflux for the last 22 years in greater than 400,000 children worldwide. So it's safe, and it's also used as a bulking agent for fecal incontinence for the last 12 years. That just shows you that also about that safety profile, because if you did have rectal wall invasion, this product has been utilized specifically in the rectal wall in fecal incontinence. So showing that the product is well tolerated. But Barrigel is, again, because of visibility, because of safety, because of precision, I can go on, has 0 embolisms, 0 Barrigel-related adverse events, and it is the only reversible spacer. It is utilized in currently about 7,500 procedures. It is commercial use in Europe, Australia, coming soon in Japan, and now in the US after FDA approval. Thank you.